Hello, my name is Dr. Hytham Rashid, and I'll be presenting today on a systematic review of coronary air emboli following percutaneous lung biopsies. Coronary air emboli, or CAEs, following CT-guided percutaneous lung biopsies are a rare complication with potential for fatal consequences. Additional research is needed to identify risk factors and early symptoms in coronary air emboli in order to improve their outcomes. So our objectives in the study were to identify the potential risk factors, compare the incidence by technique, and compare outcomes, especially as lung biopsies become more and more commonly performed. Now, methods, we searched PubMed for this following terms: coronary air emboli, coronary air embolus, and CT or percutaneous. Four independent reviewers screened all the studies to identify 31 unique case reports. Then we went ahead and did data extraction to pull as much data as possible, which you'll see in the results in tables 1 and 2. However, in that analysis, as you'll see in our figure to the bottom left, we initially found 525 items of literature. 180 turned out to be duplicates, so we were left with 345, which we looked for eligibility. 315 ended up excluded because they did not meet all of our inclusion criteria, which left us with 30, including case series, of which there was a total of 31 final cases included in this analysis. Now, in our results, you'll see in tables 1 the baseline characteristics and table 2 the outcomes. Some key points to identify is that the mortality is actually much lower than expected. 24 of the 31 individuals identified in these cases did survive. That's 77.42% survival rate. As well as you'll notice that the location of the coronary air emboli is significant. So RCA tended to be more dominant than anywhere else. And that has to do, we realized, with the anatomy of the RCA coming off anteriorly and first from the cardiac circulation. Now, table 2 in our outcomes also goes into an analysis in terms of mortality, expired versus survived, as you'll see in the top column titles. Based on a number of parameters, including cough, which is anecdotally considered a risk factor for cardiac arrests, and coronary air emboli therefor. And as you can see, actually only the majority of patients didn't cough. So that kind of went against what we know. Again, you'll see the location of coronary air embolus correlating with the RCA predominance wasn't fatal. The majority did survive, as we expected based on the baseline characteristics. Now, what about the utility of hyperbaric oxygen, which is anecdotally recommended? And unfortunately, the minority of patients received it, only 9 total. But of those 9, 7 survived and 2 expired. So it does point in the direction that hyperbaric oxygen is of further utility. However, in our discussion, you'll see we do comment on the need for the widespread utility and rather utilization of hyperbaric oxygen, as very few sites are capable of it. So in conclusion, while RCA was the most common site and hyperbaric oxygen therapy did show survival benefit, further studies are needed to identify additional risk factors, and the data is limited by case reporting, which is an inherent bias to a systematic review. We look forward to further researching it. Thank you for your time.